So today we're gonna learn about oral cancer. Oral cancer is a part of a group of cancer called head and neck cancer. Oral cancer or mouth cancer can develop in any part of the oral cavity or oropharynx, including lips, tongue, hard and soft palates, salivary glands, lining of the cheeks, floor of the mouth, gums and teeth. So oral cancer is a part of a group of cancer जो head and neck में होता है. It can happen in any part of the oral cavity including salivary glands, lining of the cheeks, floor of the mouth, oropharynx, gums and teeth, etc. So what are the etiologies, the causes of the oral cancer? Tobacco, alcohol, chronic irritation, sun exposure, personal history of head and neck cancer, human papilloma virus infection, and it also depends upon the age and sex of a person. So the first one is tobacco and alcohol. So the person who consumes tobacco and alcohol is at risk factor of causing oral cancer. Then chronic irritation in the mouth, continuous irritation in the mouth for long term can cause oral cancer. So excessive sun exposure, then any personal history or family history of head and neck cancer, and infection of human papilloma virus, and it also depends on the age and sex of a person. So let's focus on the clinical manifestation. Painless sore or a mass that will not heal, a painless lump on the lip, in the mouth or a throat, unusual red and white patches in the mouth. The red ones are called as erythroplakia and the white ones are called as leukoplakia. The leukoplakia are more malignant in nature, they spread. Bleeding in the mouth, bad breath, hoarseness or the change in the voice, difficulty in swallowing, difficulty in chewing and moving the jaw or tongue, irritation, numbness or bleeding in the mouth, persistent sore throat and painful swallowing, weight loss, swelling of the jaw and pain in one ear without hearing loss are some of the signs and symptoms of oral cancer. Then here comes the nursing management of patients with oncological conditions. So first one is surgery. So different surgery techniques are used to remove specific type of oral tumors including primary tumor resection, mandible resection or mandibulectomy, maxillectomy, Mohs micrographic surgery, laryngectomy, radial neck dissection, plastic surgery, etc. Then second one is radiation therapy. In radiation therapy may be administered externally with a machine, internally with the radioactive materials. Some people with oral cancer have both kinds of radiation therapy. Chemotherapy. Chemotherapy drugs used most often for cancers of oral cavity and oropharynx are cisplatin, 5-fluorouracil, carboplatin, plexitexel, docetaxel, etc. So this was about the medical management. Now comes is nursing management. Post-operative management. First is maintaining patent airway. So for maintaining patent airway, we have to monitor the respiratory rate, depth, note of ease of breathing, auscultate the breath sounds, investigate restlessness if patient has restlessness, then dyspnea, etc. Then secondly, elevate the head of the bed to 30 to 45 and provide fowler position to the patient. Then encourage effective coughing and deep breathing. Mobilizes secretion to clear the airway and help to prevent respiratory complications. Provide supplemental humidification, oxygen administration, decreases mucus crusting and facilitates airway clearance. Maintaining proper position of laryngectomy, tracheostomy tube and observing the tissue surrounding the tube for bleeding. Then improving the ability to communicate. First, we have to review the pre-operative instructions of why speech and breathing are altered, using anatomic drawings or models to assist in explanation. Provide alternative means of communication appropriate to patient's need. Example, pad and pencil, magic slate, picture, alphabet, board, sign language. Allow sufficient time for communication to the patient. Loss of speech and stress of alternate communication can cause frustration and block the expression of the patient. Encourage ongoing communication with outside world with the help of newspaper, radio, television, calendar and clock. Maintain contact with normal lifestyle. Caution the patient not to use voice until the physician gives permission and arrange for meetings with the speech language pathologist. Then comes is maintaining the skin or tissue integrity. Assess the skin color or temperature and capillary refill in the operative and skin graft areas. Keep head of the bed elevated 30 to 45 degree. Monitor facial edema. This minimizes the post-operative tissue congestion and edema related to excision of lymph channels. Protect skin flap and suture lines from tension or pressure. Monitor bloody drainage from surgical sites, suture lines and drains. Measure drainage from Hemovac device. Change dressing as indicated. Damp dressing increases the risk of tissue damage or infection. Pressure dressing is not used over the skin flaps because blood supply is easily compromised. Clean incision with sterile normal saline and peroxide after dressing has been removed. It prevents crust formation. And the following nursing management we will learn in next video. So hit the bell icon and subscribe.